If you have been told that your agonizing knee pain after 50 is simply due to wear and tear, or that your cartilage is completely gone, I need you to pause right now, because you are likely only looking at the tip of the iceberg. Welcome back to the channel. I am Sophia, and on Dr. Sophia, we look at the raw truth behind your health, skipping the fluff. Today, we are exposing why 99% of mechanical knee pain does not actually start in your knee joint itself, and how treating just the surface is keeping you stuck in a loop of discomfort. Before we go any further, I want you to perform a quick 3-second test right where you are. Stand up. Look down at your feet. Are your ankles collapsing inward? Is your weight pushing heavily onto the inside edges of your shoes? If you feel a sharp pull or stiffness around your kneecap when you try to straighten up after sitting, your knee is not breaking down from old age. It is crying out for help because it is trapped in a mechanical crossfire. The medical system often rushes to show you an X-ray, pointing at a narrow joint space and labeling it osteoarthritis. They promise that a pill, a shot, or an expensive surgery is your only way out. But according to major health organizations like the National Institute of Arthritis and Musculoskeletal and Skin Diseases and the American Academy of Orthopedic Surgeons, while osteoarthritis definitely causes pain, swelling, and a frustrating loss of motion during simple tasks like climbing stairs or standing up, the joint itself is rarely the root villain. Think of your knee as an innocent middleman, a structural bridge stuck between your hip above and your foot below. It is designed to glide smoothly in one direction, but when your hip control fails or your foot arches flatten out, every single step you take twists and grinds that middleman under immense, unnatural pressure. The pain you feel is real, but the true source is often hidden in your tight muscles, weak glutes, or collapsed ankles, not just the cartilage surface. If you are tired of temporary fixes that only silence the signal without fixing the cause, hit that subscribe button and give this video a thumbs up right now. By joining our community today, you ensure you never miss these critical, straightforward health insights that help you reclaim your mobility safely without relying on guesswork. Let us pull back the curtain on what is truly happening inside your lower body and explore exactly how you can start resetting your joints from the ground up, starting today. Let us break down the first 2 hidden mechanisms that are quietly overloading your joint every single day. The first mechanism involves the severe tightness and shortening of the muscles surrounding your knee, specifically your front thigh muscles, the quadriceps, and your back thigh muscles, the hamstrings. When these soft tissues get chronically tight, they act like over-tightened ropes, pulling on a delicate pulley system. Your knee suddenly struggles to bend and straighten fully. You might notice this when you try to stand up from a deep couch and feel a stubborn, rigid, stuck sensation, or a sharp pulling feeling behind your leg after sitting for just 30 minutes. Leading medical groups like the National Institute of Arthritis and Musculoskeletal and Skin Diseases, alongside the American Academy of Orthopedic Surgeons, confirm that this lack of flexibility leads directly to pain, swelling, and a frustrating loss of movement. It turns everyday tasks like walking across the room or climbing a flight of stairs into a massive chore. You might assume your joint is permanently damaged, but very often it is just your tight muscles locking the knee in a vice grip. But why do these thigh muscles tighten up in the first place? That brings us to our second mechanism: weak hip and butt muscles. Your glutes and outer hip muscles are the absolute foundation of your lower body, acting as the primary stabilizers for your entire leg. Clinical research has revealed a startling fact. Individuals suffering from chronic knee discomfort typically have hip muscles that are 16 to 27% weaker than healthy individuals. When your hip anchors are weak, they cannot hold your leg in its proper track. As a result, every time you take a step, walk down a curb, or try to stand up from a chair, your knee helplessly buckles or caves inward toward your other leg. You might notice your buttocks getting tired unusually fast, or find yourself swaying your upper body from side to side just to keep your balance while walking. This caving motion constantly twists the knee joint, grinding the internal tissues under an unnatural, skewed angle. The excellent news from these same extensive clinical reviews is that specifically, waking up and strengthening your outer hip muscles can instantly take the emergency load off your knee middleman, rapidly reducing pain and bringing your daily function back to life. You see, you might have been told to accept your knee discomfort as an unchangeable reality of getting older. You think your joints are just worn out because of your age. But that is a major misunderstanding. Your body simply adapts to what repeats. If you keep walking on a joint that is being crushed by tight thighs from the front and left completely unsupported by weak hips from the back, the pain will inevitably persist. It is not that your body is inherently weak or failing you. The mechanical signals are just broken. By finally recognizing that your knee is simply an innocent victim of tight thighs and sleepy glutes, you can stop wasting your time and money on temporary solutions that only mask the symptoms, and instead prepare to fix the true structural source. Now, let us move further down the lower chain to examine how your structural alignment and your feet dictate the survival of your knee joint. This brings us to our third mechanism, the misalignment of your hip, knee, and ankle, which forces your entire body into a destructive, compensatory way of walking. A comprehensive, systematic review has revealed that specific biomechanical traits during walking are heavily tied to chronic knee discomfort. In fact, individuals who exhibit what is called a varus thrust, which is a sudden outward bowing or shifting of the knee when your foot hits the ground, have a staggering 3.84 times higher odds of reporting knee pain compared to those who walk with a stable, straight alignment. In your daily life, you can spot this mechanical error very easily. You might find yourself limping slightly, leaning your entire torso over to one side to shield the joint, taking unnaturally short steps, or feeling a sharp, biting pain whenever you quickly change direction or turn your body around. Your knee is literally being twisted sideways because your leg's structural axis is completely off track. This leads us directly to our fourth hidden mechanism, which is often the most overlooked culprit of all: flat feet and overpronation, where your ankles collapse inward. Your feet are the literal foundation of your entire body. High-quality human studies have proven that overpronation dramatically alters the mechanical loading of your lower limbs and your torso. It increases what we call the knee adduction moment, which is essentially an intense inward crushing pressure on the joint, while forcing your shin bone to rotate unnaturally and causing your upper body to lean sideways. The science is completely clear. When someone with knee wear and tear also has flat feet, they experience significantly more severe pain and much poorer overall knee function. Out in the real world, you will notice your inner ankle bones sinking down toward the floor, your foot arches completely flattening out when you stand, or the inside edges of your favorite walking shoes wearing down much faster than the outside. Your collapsed foot arch acts exactly like a sinking foundation under a house, dragging your knee inward every single time you walk or try to perform a partial squat. Here is the dangerous trap that many well-meaning people fall into: a real false friend. You decide to start walking 10,000 steps a day to improve your health or manage your weight. You think you are doing something wonderful for your body. But because your foot arches are completely collapsed and your lower body alignment is twisted, that extra walking does not heal you. Instead, without proper foot support and stable alignment, every single step you take acts like a hammer smashing directly into your vulnerable knee joint. You do not need to work harder. You need to send the correct mechanical signal. Your structural foundation is simply sinking. By understanding how your collapsed arches and skewed walking patterns are forcing your knee to buckle, you can stop blindly fighting the local pain and finally fix the mechanical root cause. Let us move to the fifth hidden mechanism, the chronic tightness of your soft tissues and the web-like network called fascia. Fascia is the protective wrapping that surrounds your muscles and joints. When your lower body mechanics are out of balance, this tissue becomes stiff and glued together, particularly along the outside of your thigh, around your kneecap, your calf, or even the sole of your foot. In your daily routine, this feels like a tight rubber band constricting your leg. You might notice that gently rubbing the area brings immediate comfort, but pressing down hard causes a sharp, sensitive ache. Now, while direct scientific evidence for specific self-rubbing tools is still limited, multiple major reviews on hands-on manual therapy for knee discomfort show a clear benefit. These clinical studies confirm that releasing the tension in these surrounding soft tissues can provide significant short-term pain relief and quickly improve your joint's range of motion and physical function, even though the overall quality of evidence is still developing. This brings us directly to the sixth mechanism, which might completely surprise you. Your knee pain might actually be a trick being played by your hip. The National Institute of Arthritis and Musculoskeletal and Skin Diseases explicitly points out that structural issues or arthritis inside your hip joint can radiate deceptive pain signals straight down your thigh and into your knee. This means you could be suffering from severe knee discomfort, yet the true source of the problem does not reside in your knee at all. The telltale signs are very specific. Your knee pain is often accompanied by a deep stiffness in your groin or buttocks, and you find it increasingly difficult to rotate your leg outward, cross your legs, or lean down to tie your shoes. Your knee joint is perfectly healthy, but it is taking the blame for a stiff, struggling hip. When we look at the complete biomechanical picture, it becomes perfectly clear why this happens. Your knee is a classic intermediate joint caught in the middle. It is constantly forced to absorb the heavy weight coming down from your upper body and hip, while simultaneously managing the impact forces traveling up from your foot and ankle. If you have weak glutes, poor hip stability, a collapsing foot arch, or an altered gait to avoid discomfort, the compressive and twisting forces passing directly through your knee change completely. This is why your pain can easily be triggered by your hip, your thighs, your calves, or the surrounding soft tissues, rather than a permanent loss of cartilage. Remember my golden rule. Do not silence the signal. Find the cause. The 10-second lower body assessment now, instead of just guessing why your lower body is out of alignment, let us perform a simple, safe, 10-second interactive check right now to reveal your specific mechanical weak links. To ensure absolute safety, make sure you have a sturdy chair and a solid wall nearby for support before we begin. Here are the 4 quick steps to analyze your movement. The 5-time chair stand test. Place a firm chair behind you, cross your arms over your chest, and slowly stand up and sit down 5 times at a controlled, gentle pace. As you do this, look down at your kneecaps to see if they track straight forward over your toes, or if they helplessly dive inward toward each other every time you push upward. If they collapse inward, your hips are failing to stabilize your leg under a functional load. The wall-supported single-leg stance. Stand sideways next to a wall. Place one hand lightly on it for balance, and raise one foot slightly off the ground for 10 to 20 seconds. Observe whether your pelvis drops on the unsupported side, your torso leans heavily toward the wall, or your standing foot completely flattens against the floor. Any of these signs point directly to weak glutes and an unstable base. The shoe sole inspection. Pick up a pair of your most frequently worn walking shoes and look closely at the bottom soles. If the rubber is worn down significantly more on the inner edge of the heel and midfoot, and your ankles visibly tilt inward when standing, you are dealing with overpronation, meaning your foundation is actively sinking. The post-rest soft tissue test. After sitting down comfortably for 20 to 30 minutes, straighten your knee completely and take a few steps forward. If you immediately feel a tight, restrictive, pulling or tugging sensation around your kneecap or down the back of your thigh that gradually eases up after a minute, your surrounding soft tissues and fascia are heavily contributing to your daily discomfort. Please understand that these quick home checks are designed purely to help you understand your unique movement patterns and mechanical habits, They do not diagnose structural diseases or replace professional medical imaging. If you ever experience sudden, severe joint locking, an absolute inability to bear any weight on your leg, or visible new deformities, you must stop immediately and consult an orthopedic specialist. To wrap this up, your practical summary is to remember these 4 quick actions. Check your knee tracking as you stand. Feel your hip stability on one leg. Inspect your shoe soles for uneven wear, and note any tightness after resting. If you just discovered that your knees cave in or your shoes are worn out on the inside, type your results in the comments below right now. Let me know your age and how many of these signs you noticed, so we can customize your journey together. Now, let us move away from pure theory and step into action with a structured, highly effective daily protocol that I call the 10-minute Golden Knee Reset. The current medical literature completely supports this practical approach. The American Academy of Orthopedic Surgeons strongly emphasizes that targeted exercises designed to increase your range of motion, flexibility, and muscle strength are the absolute cornerstone of long-term recovery. Furthermore, comprehensive medical reviews on manual, hands-on therapy confirm that gently working the surrounding soft tissues provides immediate, short-term pain relief and noticeably improves joint function. However, we must treat this as a safe daily routine to recondition your lower body, not a sudden fix to reverse years of structural compensation overnight. Remember my motto: you do not need to work harder. You need to send the right signal. Before we begin, here is your essential safety condition. If you ever feel a sharp, stabbing pain, or if you feel dizzy or short of breath, you must pause immediately. The first step of the Golden Knee Reset is gentle mobilization. Sit down on a sturdy chair with your back straight. Slowly straighten your leg out in front of you, as far as comfortably possible within a pleasant range. Hold it for 2 seconds, and then gently bend it back underneath the chair. Perform this 10 times per leg. If this feels too difficult or causes a dull ache, here is the easier regression version. Simply slide your foot forward and backward on a smooth towel across the floor to eliminate the heavy pull of gravity. The goal here is a smooth, controlled motion within a completely pain-free zone. The most common mistake is rushing through the movement or forcing the joint to snap straight. You should feel a mild, comfortable movement, not a biting pinch. The second step is the safe, soft tissue release. Sit comfortably and use the palms of your hands or your fingers to gently stroke and massage the large muscle groups surrounding your joint. Spend 30 to 60 seconds gently warming up your front thigh, your hamstrings at the back of your leg, your calves, and even the sole of your foot. The force should be light and soothing. Think of a gentle, melting pressure, never hard or aggressive digging into the tissue. Here is a major red light warning. You must absolutely avoid pressing directly on the knee joint line itself. Any visible swelling, raised varicose veins, bruises, or points of intense, sharp pain. Keep this initial routine highly conservative. Spend no more than 5 to 10 minutes total for the entire session, just once a day for the first few days, to see how your body responds. How do you know if you are moving in the right direction? A correct response means that immediately after the routine, your knee feels noticeably easier to straighten. Your steps feel lighter when you walk across the room. And that rigid, tight pulling sensation around the joint is greatly reduced. On the other hand, a wrong or dangerous response means your pain increases and stays elevated for hours, or you notice new bruising, radiating numbness, or increased swelling. If any of those negative signs appear, your body is telling you that the pressure was far too aggressive. To summarize this entire protocol, remember these 3 simple daily actions. Gently mobilize your knee through a pain-free range from a chair. Massage the surrounding thigh and calf muscles with a light melting pressure while strictly avoiding the joint line. And closely monitor your body's response the next morning. Starting with the easiest version is not cheating. It is the smartest way to build a stable, pain-free foundation. Now, let us talk about the trap of temporary fixes, because masking your pain with quick surface solutions is one of the biggest reasons knee problems get progressively worse over 50. When you take a pain reliever, you are only silencing the emergency signal your body is sending out. A pill or a topical gel cannot fix a twisted lower body alignment. It cannot wake up your sleeping glute muscles. It cannot rebuild a collapsed foot arch. And it absolutely will not correct a faulty walking pattern. The American Academy of Orthopedic Surgeons notes that while oral or topical anti-inflammatory medications can temporarily reduce your pain and improve short-term joint function, true long-term treatment must always focus on non-drug options. This means you must actively modify your daily activities, commit to targeted exercises, manage your weight if necessary, and use proper physical therapy to fix the mechanical source. Another massive mistake is blindly buying generic shoe wedges over the counter to fix your knee pain. You might think a simple wedge will instantly straighten your leg alignment. But the American Academy of Orthopedic Surgeons actually does not recommend using generic shoe wedges for general knee discomfort. In fact, using the wrong wedge without a proper evaluation can throw your alignment off even further, making your pain much worse. If you truly have severe flat feet or a collapsing ankle, your body requires a highly personalized custom orthotic or arch support that is specifically tailored to your unique foot structure. Choose stable, supportive shoes with clean, unworn soles instead of relying on cheap, mass-produced inserts. Most importantly, we must establish your strict red light safety system. There are moments when you must completely stop any self-care routine and seek immediate medical evaluation. First, if your knee joint becomes warm to the touch, noticeably red, or significantly swollen, or if you develop an unexplained fever, you need to be examined directly by a physician. Second, if your knee completely locks up, safely refuses to bear any of your body weight, shows a visible new deformity, or feels completely unstable after a sudden fall or injury, do not try to exercise through it. Third, if you develop unusual pain and swelling in just one calf, this could indicate a serious blood clot. You must never massage this area and should seek emergency care immediately. Finally, if you live with severe arthritis, advanced osteoporosis, diabetes, peripheral neuropathy, or deep varicose veins, your tissues are incredibly delicate. You must only use the lightest touch, and you absolutely should consult your doctor or physical therapist before attempting any new home protocol. To wrap everything up, your knee discomfort is almost never a simple sentence of unchangeable age or permanent structural breakdown. Your knee joint is a brilliant messenger, a structural bridge showing you exactly where your lower body movement has gone off track. If you want to achieve lasting relief and protect your joints for the next 20 or 30 years, you must stop treating just the local surface and start addressing the entire mechanical chain. You are fully capable of reconditioning this pathway, starting today. Let us review the 3 essential actions you need to take. First, stop letting your tight thigh muscles lock your joint in a vice grip, and use the gentle mobilization and soft tissue release we practiced to melt away that chronic tension. Second, stop letting your knees cave inward by gently waking up your outer hip and glute stabilizers. Third, look down at your foundation. Protect your collapsed foot arches with supportive footwear, and always listen to your body's red light safety system. But here is the absolute truth that nobody tells you in the clinic. Even if you perform this 10-minute golden knee reset perfectly every single day, you might still be actively destroying your joints without even realizing it. Why? Because the moment you step outside to get your daily exercise, your old walking habits take over. Walking is the most repetitive activity you do, and if your biomechanics are slightly off, every single step acts like a heavy hammer pounding away at your vulnerable cartilage. In fact, there are 5 incredibly common walking mistakes that people over 50 make every single day. Mistakes that turn a healthy habit into a recipe for severe joint breakdown. You might be taking steps that are too long, pushing off the wrong part of your foot, or tilting your pelvis in a way that forces your knee to take a brutal, crushing load. That is exactly why I have created a vital, step-by-step guide to help you fix this immediately. I want you to click on the video appearing on your screen right now, titled 5 Walking Mistakes That Are Destroying Your Knees After 50. In that video, we will look directly at your walking posture, identify the exact errors that are undermining your progress, and show you how to transform your daily walk into a powerful tool for joint healing. Do not let your daily steps work against you. Click over to that video right now, and I will see you there.